We're about to get started with the 10th session of our thought leadership session. We're so grateful for you joining us today. And thank you so much for spending this time with us. My name is Jason White. I am the founder, president, and CEO of the National Range Workforce Collaborative. And if this is the first time you're joining us, our thought leadership series is really our way of working to encourage continuous learning in the field, where every quarter we get together on one national platform to really consider some of the leading practices, strategies, policies, and approaches that are really making an impact in the field. And today, I'm super excited actually to have this conversation. Our session topic is pathways to employment in the healthcare system. And this topic is very important because according to the Bureau of Labor Statistics, when we're looking at the trend in terms of employment growth over the next decade, healthcare and the social assistant industries is expected to grow to produce approximately 45% of the jobs growth that we're expecting to gain over the next decade. However, as many of us who are on this call are aware, the industry, healthcare in particular, is typically known to not be one of those industries that are friendly for individuals who have a criminal record. And this is significant because it significantly reduces the amount of the number of opportunities that are available. As a matter of fact, oftentimes educational institutions and even training providers discourage individuals from applying for employment in this particular industry. Now, today, I am very excited to share that there is a healthcare system that's based in Rhode Island, Lifespan, that's actually making a difference in this space. And we're very excited to have them on today to talk a little bit about their program. And we had them actually at our conference that took place in October. And we were so encouraged by the feedback that we got from the attendees that we decided to go ahead and have this session to go a little bit deeper into the work that they're doing. Part of the reason why I am excited about this particular session is because we have multiple representation from the organization. We're talking about individuals who are working on the front line, who are serving the participants that they're preparing for employment in the health system, to middle-level manager who spearhead the development of the program, and even an executive leader who is playing a decision-maker role. So when I think about a mix of panelists, I couldn't think about a better mix. And to get us started today, I'm actually going to invite Alexis Devane, who is a program manager at Lifespan, to join me at this time. Alexis, would you mind joining me?
Hi, thanks, Jason. I appreciate that that warm introduction. So as you heard, we are here from Lifespan, which is the largest employer in the state of Rhode Island. We have 17,000 employees across the state, across our healthcare system. We are the largest healthcare system in the state of Rhode Island, with over 1,600 hospitals and clinics. As you heard, I'm here from Workforce Development. Our department was established 20 years ago within HR and talent acquisition. It offers multiple programs that create access to the opportunity for employment with career pathways. So jobs that lead to advanced pathways for individuals from underserved populations. So historically, we've targeted opportunity youth, unemployed and underemployed Rhode Islanders, and now our newest program focuses on those seeking fair chance hiring. So those who would otherwise not be eligible for employment due to adjudication restrictions that we all know too well. Essentially, at Lifespan, we recognize the importance of building our own workforce. So our own workforce to address our staffing shortages by sourcing unseen and untapped talent that have been excluded from the workforce due to various reasons that affect disadvantaged communities. All of our job training and employment programs combine on-the-job training, work readiness training that combines professionalism and social and emotional learning. We offer case management and wraparound support services to address barriers to employment like childcare, transportation. We also assist with food and housing insecurity, mental health services, and so much more that we see too frequently. These are all core components of our Pathway to Employment program, which is why we're here today. That program recruits justice involved individuals to work for 16 weeks in the transport department at our largest hospital, Rhode Island Hospital in Providence, Rhode Island. Folks that are employed through this program earn Lifespan's minimum wage for $17 an hour, with performance-based eligibility for long-term employment upon conclusion of the program in the 16 weeks. Excited to report that we completed our first class, our piloted class earlier this year. We graduated 9 out of 11 participants. Of those graduates, 100% received job offers and are still employed. They now earn $18 to $24 an hour and have the opportunity actually to work overtime and holiday pay to increase that income. They all receive a 401k, which has the ability for 6% employer match, healthcare benefits for themselves, their families, 24-hour employee assistance program, EAP services. I mention this because it's just such a robust opportunity for those who are often go so underserved. And our second cohort is in its 12th week, and 10 people are expected to complete that program. And the goal is to have all 10 receive job offers. But none of this would be possible at all in any way without the team that we've assembled here at Lifespan. So as you heard earlier, I'm joined by Jay Benitez, our Workforce Development Program Coordinator, who is the one who manages this program, and Dave Sinapi, a great leader we have here. I am honored to work with him and have his support. He's the Vice President of Talent Acquisition and Sourcing. So Jason, with that, I'll turn it back over to you.
Awesome. Thank you so much, Alexis, for that wonderful introduction, and thanks panelists for joining me at this time. Actually, audience, just so you know, our chat pod is disabled. However, we want you to share any questions or ask any questions you may have in the Q&A pod. So if you could do that, and I do see someone asking a question already, please do that throughout the course of the webinar. And we will be having a Q&A section at the end of the latter part of our time here. So at this point in time, we want to spend a little bit of time, David in particular, I'm curious to hear a little bit about the backstory, about the reason why the program was started. But the way that I'd love for you to consider this question is, if you could describe the labor market shortage and any environmental factor that took place during the time when your company was exploring whether or not to go this route. Could you talk a little bit about the labor market shortage and the environmental condition that was taking place in Rhode Island during that time?
Yeah, Jason, thank you. Hi, everyone. Dave Sinapi, and Vice President Talent Acquisition at Lifespan. And in reference to Jason's question, for us, as most healthcare systems, it really began with the onset of COVID. When COVID peaked in 2022, we were facing over 2,400 open positions. So we had a tremendous need to fill on all levels, all shifts within the system. At the same time, there was a shortage in the marketplace of just individuals in the workforce. Compounding that in healthcare is that as a system, we did require the COVID vaccine. So we not only lost individuals that were employed at Lifespan because they declined to receive the vaccine, individuals that may have thought of joining the healthcare industry that did not want to receive it was another barrier to them coming to Lifespan. So we faced this tremendous challenge based on just the COVID and also the marketplace. So you know, as we looked at that, and concurrently with that was part of my department is, you know, we have a TA operations team that does the onboarding of new hires, and that part of that is the background check. Along with the background check, we have background check adjudication standards. What we were noticing also were individuals that, based on our adjudication standards, we were not able to hire because of some thing in their background, criminal history. And so we, you know, with the shortage we had and the need for staff, and then we had this dilemma with our adjudication guidelines, the discussion started in terms of looking at that and what could we do differently. At the same time, Alexis came to me with the Pathways program. So we had the discussion in terms of what would be our best approach. And we made the determination that really to move forward in this area, the best approach was to the Pathways program within workforce development. And that's how the seed was planted. And we began then designing. Jay joined the organization, and you know, Alexis and her team put the Pathways program together. And the reason we felt it would begin there, I think some of the things that Alexis mentioned was just the infrastructure in place within workforce development, the wraparound services they have with other programs that they currently offer. And then for us as a broader organization, to learn from the cohorts that Alexis, the first and then the second cohort, to then look to the future as to what can we do more broadly at Lifespan.
Awesome. Thank you so much for sharing that thought. And it's just interesting how things often line up at times. You know, Alexis, I would love to get into your mind, right? You talked about, Dave just mentioned that you came to leadership, right, with to propose the Pathway program. Could you tell us a little bit about the story of some of the things that may have been taking place in the background and why you actually decided to propose this program to leadership?
Yeah, I would love to. This program actually has been a dream of mine for years and years. And what we did long ago was recognize that when we started the department was that we had an obligation to our communities to advance our communities, and what could we do so. Often with, you know, it's thought of as a healthcare system, we're going to provide health promotions in the communities. But what we did instead was look at it as employment being an opportunity for that to affect our communities through social determinants of health, community development, and more. In any event, fast forward, we created programs, as Dave mentioned, our infrastructure. We had a youth employment program that hired youth throughout the summer with work readiness training and more. Then we created another program to address our shortage for CNAs, nursing assistants. With the success of that, we went on to see where our other vacancies were. So medical assistant, farm tech, phlebotomy, we're now looking at surgical processing tech. Those programs offer free training with all the other things I mentioned, from case management, support services. So we were really able to, as we looked at, we need to address our staffing shortage. We had the infrastructure in place. We had programs in place that we showed were effective. Our programs from the ones that I just mentioned, from 2020, the onset, April 2020 to now, I've hired almost 700 people out of our programs who are from our communities, unemployed and underemployed individuals. So we have evidence base to say investing in our communities in an unseen talent is beneficial. There's a return on that investment. In addition, we had a funder came to us and wanted to support underserved populations. And we received $10 million on top of the $7 million that we've received over time. And so it was sort of a no-brainer to propose, all right, we're really good at building populations who are not getting access to fill this shortage that we're all complaining about. And I mean, it's a problem. We're all seeing it. And so we said, let's do the same for a population that no one is looking at. And in terms of places that have strict adjudication policies. And so going to leadership with this, we were able to say, we are successful at this. We show the evidence of why we need and can do this. And we're proposing it on a pilot base, a cohort base. Our programs start with cohorts, which is what makes us different. And it takes leadership like Dave and those among him to say, you know what, I hear you. We've got something that works. Let's model it. Let's see if we can do the same. And so it becomes something that consider us an internal one-stop. Lifespan has its own one-stop or job center, and recognizing that is a great feeder for these jobs. Our leadership was able to say, okay, we will endorse this. We believe in it, but we needed to get that in order to get it on the ground, combined with the money.
Awesome. So securing the resource, pitching the program, securing leadership commitment, all of those things are essential to start a program. You know, I want to switch to Jay for a quick second. Alexis, thank you so much for sharing the backstory. Jay, you are unique in that you have worked in the nonprofit sector, in the community, actually. Now you're working for the company here at Lifespan. But you're also a person with lived experience. And so you have a very interesting perspective to share, right? So from your perspective, what is the significance of this program? And especially you being internally now actually leading this, helping to lead this initiative.
Yeah, thanks, Jason. Yeah, it's been really interesting because, you know, you and I have talked offline about my experience in the nonprofit CBO world, and I have extensive experience in that realm as a job developer, as a case manager, as an employment specialist. So, you know, I've spent a lot of years working to move people into employment from a CBO perspective. And, you know, coming to Lifespan, I look back on some of those instances and I'm just like mortified. You know, I can't believe, you know, the level of work readiness that I really didn't understand from an employer perspective that I have now. So, you know, I really love that I have both perspectives because it allows me to really have meaningful conversations with our community partners about what it means for people to be work ready, specifically what it means for people to be work ready for Lifespan, which is, you know, above and beyond the level of quality that we expect from our employees, that we need from our employees is extraordinary. And you see that in the quality of service that we provide to our patients, to our communities. So having both sides of that experience has been extremely beneficial in designing and implementing this program, and then also reaching out to community partners and you know, building those relationships in a very sustainable way. It's one thing to say, hey, we're going to partner, and then not have conversations about what that really means, because both sides are going to have a perspective. CBO is going to have a perspective, and an employer is going to have a perspective. But the most important thing is to come together and really talk about what those expectations are and how you can fulfill them, or if you can fulfill them. In a lot of cases, community partners simply don't have the capacity to accomplish what we need them to for the work that we do here at Lifespan. So, and, you know, I also do have lived experience. My 20s were a whirlwind. So, you know, I spent a lot of time in and out of the system, and I just didn't know how to stay out of trouble, no matter how hard I tried. And that really started to affect me when I moved into my 30s, and I really started getting serious about my career, and it started taking shape in social services and workforce development. And so I myself have had times where I've been denied a job because of something on my background. And even today, even though it's been 25 plus years since, you know, I was last in trouble, you know, I remember coming here to Lifespan And really every job that I've had since my early 30s, I've had to have a background check. So coming here to Lifespan, you know, I still have that feeling of like, I know they're going to run a background check and I still have fear that I'm going to be rejected. So it's a lasting impact on people who are justice involved. And so I think it also helps me to relate that to the community partners who maybe don't have that experience, and also to the employer who is looking at things from a very different, and rightfully so, a different perspective.
Jay, thank you so much for sharing your story and the unique mix of experience that you have, and even being vulnerable to share some of the fears that you have, even as you're going through the recruitment process. You know, for someone that have your mix of experience, Jay, I just want to see if we could dig a little bit deeper into your thoughts. What does this program mean to you personally? Because remember, earlier on, I spoke about the growth of the industry and the reality that oftentimes persons who have a record are steered away from the healthcare industry. What does this actually mean to you to be one of the leaders that are championing a program that is an example for many to consider in the country? I'm curious to hear what it actually means to you personally.
Sure, I'd love to share that. So for me personally, you know, I got into this work because it really matters to me. People matter to me. My community matters to me. And I've lived in a lot of different communities. I've lived all over the country. I've worked in a lot of different places throughout the country. And you see a lot of similar barriers, a lot of similar just inequity that prevent people from really thriving. You know, a lot of people are out there and they're if they're even surviving, that's all they're doing. And so for me, creating a program like this and having the ability to do this kind of work, my whole goal is to get people to a place to where they can thrive, because that's where I am. And I think that's where everyone deserves to be. And, you know, the individuals that we work with, a lot of times they don't believe they deserve that. So there's a lot of work that we do on the back end and from day one, where we're talking about how important it is to do this work for yourself. This isn't just a job. Lifespan kind of is the pinnacle in Rhode Island, you know, when we recruit people and I take them to the badge office, more than a dozen times people walk out and they're like, I cannot wait to show my badge to my boyfriend or my daughter or my mom. It's a source of pride. So to be able to really create an environment where people are safe, where people can talk about their fears and be vulnerable with these insecurities that they're carrying around and have carried around for years or decades, it's incredibly powerful. Alexis and I went over to the main hospital where our participants are placed, and a lot of the folks from our last cohort were hired permanently into the transport department. And just, you know, I remember from day one when they came in for their interviews, they came in for onboarding for their first day. If you took a side by side of them, it's just amazing. Just the level of security and stability that we're able to help people build for themselves through this opportunity literally changes their lives. I mean, I hate to sound cliche. I hate, you know, it's going to change lives. It literally does, though. Living in crisis, like right now, we're in our second cohort, and we're at the stage where we're really seeing people living in crisis. They're on the verge of, you know, being like, okay, I've gotten a paycheck for the last 2 months. I've been able to save a little bit of money. I can start thinking about things in the long term, but they're still in that crisis mode. So where they're always on the precipice of self-sabotage. So having people from the previous cohort be an example to say, look, I was there. I know how it feels. I didn't get into that, and this is where you can be. It's such a powerful impact that this program has had, and just to be a part of it is a real privilege.
Well, Jay, what awesome thoughts. I really appreciate that. I promise you, I have one more question for you, and I promise I'm going to give you a break after this, okay? But you shared your story. You talked about what it means to you. You talk about a lot, actually, about what it means to individual participants. I am curious to hear your perspective, and Alexis, I'd love for you to jump in here, and Dave, feel free to jump in as well. But what do you think, what type of statement do you think Lifespan is making to the community when they're leading a program like this?
Yeah, so I'm just going to start with kind of this perspective. I'm not from Rhode Island. I've only been here for about 2.5 years, 3 years. And when I first started working here, I worked for one of our now partner agencies, which is a shelter and recovery organization. So, you know, when I first started looking at jobs, I was like, wow, Lifespan has like 2,000 job openings. This is a gold mine. And everyone around me started saying, no, you're never going to get your people in there. It's never going to happen. And so I started working with someone here at Lifespan as part of a collaborative. And then I found myself transitioning into this role at Lifespan. So what I've seen is that in just a short amount of time, I've gone from hearing that this is an impossibility, that employment at Lifespan is an impossibility, to people saying, really, you're working at Lifespan? How did you do that? And people being able to say exactly how they did that and providing that encouragement and those steps to those people in their communities. So there's really been this ripple effect. And this is our efforts right now are very small in terms of numbers, but in terms of impact, the encouragement, the level of interest, people reaching out who want to participate, who want to send people as referrals, who want to get involved, who want to come and join the program. I was telling you before we jumped on this call, really, there's enough work in this program for 3 or 4 people. And we're a small state. We've got about 1 million people here. But to give you some perspective, there's about 18,000 people on parole and probation in Rhode Island. So quite a bit of people who potentially are disqualified from working at the largest, employer in the state, and also, the employer that really provides a living wage, excellent benefits, opportunities for growth. So the impact, I could sit here and talk to you all day about how this is kind of it's just spreading in a good way.
Thank you so much, Jay. Alexis, I'd love to get your perspective on this, especially you, the person who brought this program to leadership. What do you think is the significance of this program to the community that's taking place here at Lifespan?
There's a reason I've been at Lifespan for 20 years. It is a very, very special place. And what I get excited about is that the organization and our leadership department allow me to do this work with an amazing team like Jay. And because it is so unique, and I watch the benefits it has on our communities, direct benefits, the development, healthcare is not only done at the bedside. This is a way for us to say that we're really committed to see the improvement of health of our community members. This is a way to advance and secure families so that they're no longer, or that they're less likely to rely on our emergency departments for primary care, and instead be able to maintain, their health and health improvement over time. I think for the other message for our communities is that we recognize that it is hard to access employment in a place where you're facing a staffing shortage for whatever reason. It's not so simple. And one of the things that we do in our programs is we help people navigate that system. So individuals in our communities might not really know how to navigate the employment process, access, the application. It's all requires technology. It requires, you know, background checks. It requires a number of things that we are considered a barrier to employment. And so we have a commitment to making sure that we allow that access to take place. We also are, it's important to us, and this is what we're really kind of a path that we're on, is a number of people don't apply to us because they think they won't get in, if you will, especially those with something on their background. And so what we want to be able to do is work with our community partners so that we can allow, or we can encourage folks who think they would not be able to have access to understand that they do. So for instance, I say that as the example that I use is we had a gentleman who he had been incarcerated for 30 years, and he upon his release, he came, found his way to our program through our partner, community-based partnership. Turns out he actually, he was eligible for employment with us because his background, we only look back for 7 years. And so he never would have applied because he would assume he was not eligible. One thing though, is that what's important for us in our relationship with our community is to set people up for success, at least with our programs. Someone like him in that situation, he was not ready to go into the workforce with the expectations that we may have. And so that's why our programs are in place, are to set people up for success. At the same time, we had someone else who was clearly ready, same exact circumstance, and we were able to move him into employment. So by doing that, sharing a message with our community partners and community members that we are committed to guiding people to have access to these jobs that seem completely unattainable. And I think another thing that we offer is we offer a sense of belonging here. And that's really important for our participants to may have a relationship with us as an organization and feel a sense of belonging there, because sometimes the community does not have that. And when it does, sometimes it's not engagement in positive things. So I think that the things that we provide through employment, I say jobs save lives all the time. And I also say train for skill, hire for attitude. And so what we're committed to doing is working with our communities to identify that talent that doesn't know that they would be eligible, and that also in letting them know that we are dedicated to seeing advancement of our communities.
Absolutely. And Alexis, in this space, funding is always a challenge, right? And and sometimes we have to get very creative. And earlier you spoke about securing resources going to leadership. I'm curious to hear you talk a little bit about what approach did you use to secure funding to actually get this program started, and even as you think about sustainability, what are some creative ways that you've managed to secure some resources specifically to serve individuals who are coming back from incarceration and being able to benefit from this pathway?
Yeah. That's the $1 million question. Fortunately, we got $10 million to do it, but it is the $1 million question. I go to Dave all the time, right? Dave, we need more money. But in any event, we have the success of our programs. We have been very fortunate to receive quite a bit of funding from the state. Department of Labor and Training has given us a lot of money, about $7 million, like I mentioned, to date, so that we could operate the other programs that I described. Recognizing that one of our major donors, private donor, the Pepito Opportunity Connection. That organization focuses on creating access to opportunities to entrepreneurship, education, and workforce accessibility. And they recognized what we were doing and invited us to apply. They recognized that we are so effective, invited us to apply. We asked for money for the programs that are existing, and then, I proposed let's add something else. Let's add, we continue again to do this work, but we've got to start getting more creative with it. And so with that funding, it did help advance the conversation of Dave was already doing it, looking at our adjudication policies as we went into COVID. And how can we grow our talent force? But it combined with that, that money let us really launch this program. It is, Lifespan does support a portion of it. It is largely supported by the Pepito Opportunity Connection. These programs aren't hugely expensive. And, you know, $100,000, yeah, that's a lot of money. $150,000. $150,000 though, is how much one cohort costs. And that costs, that's money for the wages of the participants, for staffing salaries and for wraparound supports. If you're going to get long-term talent that you can grow and who will stay engaged and will have a relationship with our patient populations in a way that others may not, that's a worthwhile investment. To put, and these are the kind of things that we do articulate to the organization and to our funders. So people who are in our programs, I have people who have been in programs that started 15 years ago and are working for us, that started in transport and are now managers or RNs or, you know, in a number of different areas. There is also a worthwhile investment when we talk about supporting our initiatives. So this work supports our belonging and equity DE&I strategies. If we're going to stay committed to DE&I and to anti-racism initiatives, we have to make sure we're not excluding a population that is largely of Black and Brown people. So that is one way. And then when we talked about, you know, this is another point of investment, is lived experience. So not only, again, reflecting demographically, but through lived experience. Jay, if he could have put his background on his resume for the job he's in, he's actually more eligible in my eyes to do this work. It kind of was after his interview, he was a perfect fit. And then there was something very organic about his approach. And after knowing his story a little bit more, I went, oh, of course he's great at this. You know, he has a better understanding. So looking at the nuances of our need makes it so that to request funding is a little bit easier. But I think it's important to also look at the bottom line. If you're going to a business and saying, you know, would you be willing to invest in something like this? You've got to look at what's the return for the organization and the participants or community members or employees. And the return for the organization for us is we're investing in long-term employees with a potential of advancement and retention, because that sense of belonging helps us retain this talent. And then the commitment and experience they have that will make them relatable to our patient population. And also mentioning that this is connected to organizational strategies and goals. I mean, this is, we need to be doing this. It's not as expensive as it may seem when you break down the numbers. And if you look at, Dave can tell you, like the cost of turnover, it's something that we're looking at reducing. Now, I know when we talk about 10 people, it feels like that, oh, 10 people. Well, our programs started in 20 years ago with 10 people. We have now put 2,000 people through all of our programs and hired probably about 50% of them. That's, you know, that's a worthwhile investment. And with the potential of affecting turnover and the going into communities, they're going back into their communities saying this is a great place. So people are going to seek healthcare at Lifespan, and we're also investing in our communities by allowing members to thrive economically, socially, emotionally, and more.
Well, that's exciting to hear, Alexis. I mean, you share so many valuable nuggets that we need to take away, and significant strategic steps and tactical moves that you and your team have taken to really make this successful. That being said, one of the things that I wanted to touch on, you talked about one of your funders noticing that your program has been effective, right? You know, with any reentry program, wraparound services are very, very important. So I guess maybe I'll throw this to Jay or yourself. But when you think about the offerings in terms of wraparound services, how does that look, and how does partnership fits into this, maybe potentially with a community-based organization, or what do you provide in-house as far as wraparound services and support are concerned?
Jay, I'll jump in, but I want to turn it over to you because of your strong relationships with our community-based organizations. I think that a message that I would like to steer towards employers, you know, from the angle of the employer versus the community, the investment in wraparound services is critical. If you want to build a workforce, we've got to put some money into it. People are flocking to, we lost a ton of people at our organization, from the requirement for vaccines to people were leaving healthcare. It's hard work, and it was a scary place with the pandemic. What we found was our programs were recruiting individuals who wanted to run into that fire. They wanted to make a difference. They wanted to make a change for what was going on in the world and for their families. So we have found very retainable talent through our programs. But the wraparound services, you can't get, I'll use the CNA license, nursing assistant license as an example. You can't get that license to fill our jobs without money to pay for that course. So we offer free courses. That is, it's $2,000, $3,000 a person for that investment. So putting that money forward is critical, but the wraparound services in addition. So not just giving the course for free, maybe. The things that we see, and Jay can talk about it, the barriers to employment, the childcare, the transportation. We're talking to others who are interested in this work across the country. The mental health services, the wraparound services. Jay sat in my office the other day. Jay, probably you spent 2 hours with one participant. I think we spent 3 hours with another one, just to come to the point of saying, it looks like mental health services are needed. Let's make this phone call and make that happen. So having the case management, having the access to resources, and having the wherewithal to understand that we got to make an investment when someone's sleeping in their car and they still keep coming to work every day. We have to make that investment. Jay, you can talk about, please talk about how you are able to make it an integrated system with the services that we have.
Yeah, and I don't want to be redundant, and it looks like we have a lot of like logistical questions, which I love to talk about. So I want to make sure we have time for that. But I will say that from the beginning, we figured in a large role for our community partners. I mean, this type of work just isn't possible without support. Doesn't matter how big the organization is or how much money is available. It has to be a coordinated effort with other agencies working towards those similar goals. So when we were going into this, support services were one of our top concerns on top of level of work readiness and program growth. So with these things in mind, we decided it would be beneficial to start our pilot with referrals from a couple of specific CBOs that could help us in providing case management and staffing cases, and also providing services that Lifespan wouldn't have the capacity to provide. So our community stakeholders, they play multiple roles. From referrals, that's how we source our referrals. And we do that because they're able to vet the candidate for us. They understand the level of work readiness that's required for a referral. They provide initial work readiness training to the candidate. And then we're able to talk with them about barriers. A lot of times people aren't comfortable talking about the barriers that they have that would be detrimental to their employment. So having a community partner that you can staff a case with is a big deal. Our goal is to work together to provide as much support as possible to each other, which ultimately translates into supporting the participant. So Alexis kind of mentioned this, but an example is the additional case management services, supports that we don't have access to, like housing and recovery services. So we created these partnership structures with the intention that it would bring us together and providing the most comprehensive wraparound services possible. On our end, we're able to provide a full-time paycheck. And we do have the availability to provide a stipend as a last resort to cover expenses that we can't explicitly pay for. But we really rely on our community partners who are very good at addressing some of the other main barriers that we find our people facing, so that we're really utilizing our supports as well. And I think that's probably the biggest point that I would make today is from an employer perspective, if they're receiving a referral for an employee, that follow-up on the CBO's side of things has to be there. You cannot refer someone for employment knowing that they have housing barriers, food insecurity, childcare issues, transportation, and say, well, they have a job now, I'm done. And I see that happen a lot. They're still going to work with all those barriers. And even the amount of money that we pay, which take home is around $2,500 a month, it's still not enough when you're catching up from years of child support payments, of trying to find first and last month's rent, when you're trying to get a car, get your car fixed. So just sending someone off into a job, that's a great start. But there has to be those follow-up services from the community-based organizations, part of the partnership, in order to really provide a meaningful partnership to the employer. So that is probably the biggest takeaway I would want to leave people with today, is if you are a referral source, make sure that you have the capacity to do the follow-up and the retention services.
That's actually a very good segue, Jay, into soliciting some advice from you. I mean, I'm excited to share that we've been getting a number of great questions from our audience, and we're going to get ready for our Q&A. But before we do that, we just heard Jay made a recommendation to the CBOs, a community-based organization that are represented here. David, you've been silent for a while, so I'm going to call on you now. I'm curious to hear, as an executive leader in this large health system, what advice would you give to other executive leaders who are in position of leadership, who can actually make decisions to really move an initiative like this forward? And especially if maybe you want to give advice to executives specifically in the healthcare space, I'm curious to see if you have any thoughts there. And remember that you're muted, so you need to hit unmute.
Yeah, thank you, Jason. Well, I think the first reaction, I think, of most executives is, can we do this? Or how can we do this? Or they're afraid to do it. And for various reasons. So even when Alexis, brought it forward, I had to bring it above my level. And then from there, internally, we went to our risk department, right? Because we want to know from that perspective, we wanted to get their input, right? Yeah. We didn't know what their reaction was going to be. So, but, they were great. They investigated our coverages. They talked to our insurance carriers. And, and from that perspective, we were fine. In turn, I had a discussion with our legal department. Want to bring them on board. Again, didn't know, kind of what the reaction was going to be. Again, it was a positive reaction to it. So I think as an organization, I don't know if we're unique or not, to those types of reactions, but, it was very thoughtful, very, because you got to weigh, right, doing a program that's the right thing to do. But then also, your current population and so forth, and making sure that you're not putting anybody at risk in terms of even, what are the people in the program, the current employees, et cetera. So we just wanted to make sure we had all those, those areas addressed and covered. So I think, you got to be kind of pragmatic in this approach, because it certainly, it could be an emotional topic, but you got to just look at it from the perspective of, can we do this? It makes sense. If you look at all the current literature, like, we've been talking really about workforce development kind of as overall picture. Companies now, whether it's in healthcare or outside of healthcare, they're all focused on workforce development. And so, I think certainly the timing is right to do this more across the country. I think it's just having the courage to bring it forward, and then whatever the outcome is, if it's yes, let's try it, let's move forward, or no, the timing's not right now for whatever reasons. But I think that's the approach we took. We didn't know what the outcome was going to be, but I think moving forward, like I say, the investment in workforce development for companies like Lifespan and other companies is really going to be the focus over the next several years.
Got it. I must say, David, hearing what happened as you brought it to your legal department, just so you know, we had a conference in October, which Lifespan was there, so I'm sure you're aware of that. But the legal department apparently is the place where these initiatives go and die. So listen, we're going to have to invite your legal department to our conference next year to talk about like what that process looked like for them, because it's definitely an example to share with the field. Anyway, that being said, we're about to start actually sharing some questions that we've actually gotten from the audience. And this is actually a good segue with you talking, David, because one of the first questions that we have here is, what reservations did leadership have to implement programs, and how did you overcome it? I'm assuming that maybe this is directed towards Alexis, but also David, please do chime in. So in some regards, I think you alluded to some of it already, but was there maybe one additional thing that you'd like to share in terms of reservation and how you went about and your upper leaders went about addressing that?
Yeah, I mean, from my perspective, I could just reiterate, and then Alexis can add to it. But I think that again, the hesitation was, you think about it from a senior executive level, it's a liability, right? I think that was probably one of the biggest hesitations. But that's why, in consultation with our risk department, in terms of knowing that we have the coverage if something was to happen, it's just. You play out the scenario, right? Not that you expect anything, but what if something happened? So I think that put that kind of at ease, knowing, hey, we can move forward. This is the reason why we have this type of insurance, et cetera. I think alleviated that hesitancy.
Can I just chime in real quick on that from like a lower level perspective? That was where we came in and we included in our business plan the what ifs. We had a very strong, solid, clear-cut risk mitigation plan that we presented. So just being proactive. I love, Dave, that you're sharing these concerns, because we were able to be very proactive just because we do have a very close relationship with leadership. We were able to be proactive in a lot of these things. So we just put together a risk mitigation plan, just looking at all the things that could possibly go wrong, the stigmas, and things of that nature.
Let me just ask a follow-up to that, because one of our persons in the audience is actually asking this. But within that risk mitigation plan, how did you factor in the adjudication policy or process?
Yeah, that's a great question, because that is also where our legal department came in. Because, as we thought about this program, it was like, okay, our current adjudication doesn't align, with this program, right? So in consultation with our legal department, they said, since this is a unique program within workforce development, we were able to, kind of, I don't want to say suspend, it just kind of, could be not as stringent adjudication as we would normally be doing. And I think the way we addressed that too was, not every referral that came over was hired from our community partners. Part of the plan, as Jay just mentioned, was to put together an adjudication team. Now, and this is much different than we do across the system for our, other hiring. So it was a team that consisted of a cross-functional team, including an individual from risk, and talent acquisition, from, the workforce development, et cetera. So, I think of putting that structure in place, also helped in terms of looking at the individuals that we eventually would be part of the cohort.
And I would say on top of that, what you're hearing a lot of is have a plan. So this is something, so if community-based partners are seeking employers to do this, have a plan. If employers are interested in doing this, do as much research as possible. And I have a colleague who says to me, make sure they can't tell you no. Go in there and make sure you have all the information. And along with trying to get that information, you might find out, actually, you cannot do this. Okay, well, then you can also find out, how can we do this? What do we need to look at? And be patient. Jason and everybody on the screen has heard me say, it's a game of chess. This is not checkers. And understanding that, not necessarily going to employers and saying, you need to do this. And employers not saying, we don't want to invest in this. It's building a relationship and having a conversation that allows everybody to be in partnership with creating a plan that benefits all. So removing emotion from this, I think, is really important when you begin it, and then involving all parties, even parties you think that might say no. Because when we got the team together, it was, Jay, you and I got a little nervous. We're like, oh my gosh, we got to go talk to this one or that one. And then the first thing as we pitched it, a little trepidatiously as we pitched it, the response is, wow, this is the coolest thing ever. I'm so excited. I was talking to our legal the other day, and I won't go off as everybody expects me to. I was talking to our legal the other day, and she said, and I said, we're going to NRWC conference in Philly. She said, I'm from Philly. She said, oh, by the way, I was talking about your work to my sons last night. That was our legal counselor. She was all on board. So building relationships, having a plan, removing emotion, looking at the return on investment and making that pitch the bottom line, and don't assume that people don't want to do this. Sometimes there's just factors that are reasons you can't, and so you work to make it so you can.
Listen, I'm super excited about all that I'm hearing. I mean, everything that I'm hearing is pointing to a program that's doing transformational work on multiple levels, even within the institution, in terms of the culture and the perspective specifically related to this population. Now, one of our attendees actually asked a question regarding the regulation, the federal regulation, right? So you have all of this work that you're doing internally, but then sometimes you have to deal with the regulations as well. So here's the question. It is, how do you manage the federal, whether Medicaid or Medicaid regulations that preclude having employees with felon convictions?
Well, I think that may be specific to specific jobs.
Yeah.
Right. So that does preclude us from hiring individuals into those roles. There's also, state regulations. Each state is different, but in terms of licensure for certain roles, so I think that's, more to come as a country, really, and as a state on the regulation side, how we move forward in those areas.
Yeah, and I would just kind of echo that. We really did have to look at what was available in terms of jobs, what needed licensure, but it's not a no. It goes back to that relationship building. So we have a very strong relationship with the Department of Health here in the state, and sometimes it's as simple as picking up the phone and saying, hey, this is what I've got going on. I have this person who's got this training. There's interest in working in this field. Can you give me some advice on how do we work around this? Wow. And we've been able to, they're willing to adjudicate as well. The answers, in my experience here in Rhode Island and in Michigan, the answer has never been no. The answer has always been, I'm gonna have to find out. And then the answer might be no, but it's a conversation starter. I think overwhelmingly people are interested in doing this. and finding ways to make it happen. So it's just about like, how do you approach it? And like, like I said, do your research and have a plan.
Wonderful. Jay, so there's the advocating for individual participants. I'm curious to hear, even as you build out this program and you're gaining evidence, so to say, in terms of the opportunities that are being created, are there any form of future plans regarding engaging at an industry level in some regards to share the success that you've been having, with the hope of maybe eventually the industry considering relaxing some of those restrictions? Alexis, I'm not sure if you wanted to take that, or Jay, or
Looking
I'll let
right
Alexis take
at Jay. You can't, the nonverbals are hard on the screen. I was looking right at you, Jay.
I was gonna answer. I still will if you want me to.
Go for it.
Yeah, actually, we are working with several other systems at this point to talk about how we've implemented this at Lifespan. And this is a long game endeavor. So ultimately, it is about changing legislation. It's about changing policies. It is about really looking at people on an individual basis. I like to say, 99% of people are criminals. Just a lot of people don't get caught. So we've all done something at some point that we haven't been proud of, but we bounced back and we made the changes necessary, and that's all these people are trying to do. So with all of the data that we've been able to collect, the outcomes that we're being able to prove quantitatively and qualitatively, the goal is definitely to make system-wide change, not just here in Rhode Island at Lifespan, but for everybody.
Thank you. I have a question here from one of our attendees. This person is trying to get to the bottom line, right, regarding career pathway. So here's the question. What does the long-term career pathway look like for graduates of the pathway program?
I anticipated this question too, actually, and I say that with a lot of love. Often we do get asked, okay, where does it stop in transport? The goal is, so part of our program, and what the benefit of having it be cohort based, is that we can continue to work with our graduates who are working for us. And what we know through the other work we do is that there are jobs that do not require, so for instance, the licensing for our farm tech is a program we have. Well, that one is going to require a background check, and it's likely that our participants will not be able to access a role like that. But we're familiar with other areas where there's a shortage that we're able to advance those in our programs, like the sterile processing tech role, the CNA role. Although there's challenges with the Department of Health for licensure, there's actually, as Jay said, we pick up the phone and we ask them, and many of them realize that a lot of the assault cases are the victims of an intimate partner violence incident. For long-term, we will then work with individuals and help them access these other roles that are often thought of having certifications that would be barriers to advancement. Sometimes people think that something may require medical assistance for us. The national certification is not required to work here. So there, and in our program, in our department, we have programs that offer medical assistant training, the nursing assistant, phlebotomy, and behavioral health specialists, and more that I talked about. So those in our program will have the option to also go through that other track that we offer, which are courses for free, and they can do that while they work with us. It should be of note too that their background will not be run again now that they're employees in our program. Their background check is not going to be run again to go into another job. It is something we will have to look at the specific licenses that would have barriers, and that's where it goes back to Jay's point of making change.
Got it. Thank you. we're getting very close to time. So with the next few minutes, I have actually one more question, and then I'd love to wrap up with maybe a last thought from you, specifically regarding this topic that we're addressing. So can you share your assessment tool or make a suggestion from training, the type of training, I should say, that could be offered for participants who are getting prepared for careers such as those offered by in Lifespan?
Yeah, and I just, and please let me know if I didn't understand the question correctly, but what I think I'm hearing is what kind of training, the assessment tools. So the type of training really is dependent on the employer. It has to be employer driven. So if you already have a structure in place of work readiness training that you're offering your clients, participants, and you have an employer that you want to work with, I would encourage you to take that to the employer and say, look, this is the work readiness training that we offer. If we were to refer people to you for employment, what else would you want to see in an employee? As far as assessment tools, we do look at their previous work experience. We do look at what kind of training they have received, either while incarcerated or since they've or post-release. We want to know the full story. So the assessment really is a conversation, really is like very comprehensive in terms of what are your barriers, and we have a very specific list that we go through, even down to bed bugs, because a lot of people, like I said before, just do not feel comfortable sharing that information. We don't start with the assessment. We build up through the onboarding, and then once we started that relationship building, we go into the needs assessment so that we provided trust. As far as the assessment, it's probably it's just very basic. What do you need? What do you have? What services are you receiving? What services do you need? And we get those assessments from both our community partners and from the participant as well. So I hope I answered that question.
Absolutely. Absolutely. Thank you very much. It sounds like a very thoughtful but thorough process with the goal of actually ensuring that you're identifying the right fit for your program, but also the right way to support the participants. So I appreciate you sharing that.
Can I just say one more thing real quick? I'm sorry. I know we're almost out of time. I feel like Alexis has possessed my body. What I would say to a CBO is, and this is what I say to our partners. I understand the desire to get people jobs, but if a person isn't ready, it's okay. I still want to talk to them. I want to know why they're not ready, and I want to know how we can help them get ready.
Yeah.
So it's so detrimental to the participant to refer them if they are not truly ready. Because if they go through our program, they get hired permanently, they do something that gets them fired, they'll never have the option to come back and work at Lifespan. So they're really blowing that opportunity. So that's one of the things that we really, really take a hard look at. Is this person really, truly ready? So that's where I'll end. Thank
you so much, Jay, for sharing that. Considering, Alexis, that you have been kind of the spearhead, one to spearhead this initiative, I'm going to give you the last word from your team. Only 30 seconds, okay?
Then I'm going to decline the offer if I only have 30 seconds. And Dave is panicking right now. The last word from the team, I think that, this needs to be done. And really, again, I can't emphasize enough, be patient, and be open-minded, and be willing to have setbacks, be willing to be innovative and creative. I also really, for me, I can't say how grateful I am to work at an organization at Lifespan that allows us to do this work. I also would love to, if we can share this work in any way, we would love to be a champion for others to do the same. We really do. I proudly say I have the formula for it. There's not enough in in 30 seconds to say that formula is, but we really have it in place, and we would love to speak with others about how they could do the same. And thank you, Jason, for letting us be here.
No problem. And on that note, thank you so much, Ashley, for pulling that up, because we do have the contact information for Jay, Alexis, David. You could reach out to any one of them, or even myself, if you have a question regarding our thought leadership series sessions, or in particular, if you want to get connected with the Lifespan team. I do want to share this with you. I'm sorry that we did not have our chatbot working, because I'm telling you, our attendees often have a lot of energy and a lot of encouragement to share. But I do have to share this with you. Lifespan team, one of our attendees in the Q&A couldn't help themselves but to share this. They said, "Thank you so much for sharing your program with us. It is amazing, and Lifespan is lucky to have all of you on staff." And I would say that too. I'd echo that same sentiment, because even when you think back to the healthcare industry, where oftentimes, even within our space, a lot of training providers actually steer individuals who have a record away from the industry as a whole. So for you to be the largest employer in Rhode Island and be really being a strong example, not only for your local market, but for the nation, we're encouraged that you were able to join us today, and we're really excited that we're able to help you to advance your work. So thank you so much, Alexis. Thank you, David. Thank you, Jay. And just so you know, attendees, Ashley first has been working behind the scenes. So thank you so much, Ashley, for all the work that you did to help us to prepare for this session. One last announcement. Our next thought leadership session will be on March 1st. So please keep an eye out for our message regarding that. We look forward to having you joining us again. Thank you again, attendees, for your time. We really appreciate you joining us today and spending your time with us. Take care.
Thank you, Jason.